this is Handsome Nerd ASMR, back with another video. In this video, we're going to be learning more about the Bacillus anthracis, and it will cover the Bacillus cereus in the next video. So, what is the Bacillus anthracis? Well, this bacteria belongs to the genus called Bacillus, and the species name is anthracis. And the general features are that it is a gram-positive rod, it is spore-forming, and it is aerobic. And so we'll use the sketchy image titled King Anthrax Acts to better remember all the important principles associated with Bacillus anthracis. So let's dive deeper into it. So, if you want to remember that it is a gram-positive rod and that it is spore-forming, just think about the walnuts roasting on the fire in this picture over here. So it's kind of like over here, that appears to be walnuts or something, but at the very least, just imagine that, and I can hopefully help you to remember that it is a spore-forming bacteria. To remember that it is an aerobic bacteria, think about the air bellow for the fire. So just imagine that there's an air bellow for the fire to make sure the fire keeps burning. And then for the Bacillus anthracis, some distinguishing features are that the bacteria appears like large boxcar-shaped chains, as indicated over here. And you can remember this by thinking of the chain of Viking boats, as seen over here. The Bacillus anthracis also has a polydeglutamate capsule. And a way to remember this is to think of the armor made of leathery protein and Vikings wearing multiple D belts. So, you can see the D belts over here and the armor being made of leathery protein. And that's how you know that the Bacillus anthracis has a polydeglutamate capsule. And most importantly, it is known to be a potential biowarfare agent. For its reservoirs, you can typically find them in animals' skins and soils. And for transmission, it can occur through contact with infected animals or inhalation of spores. So that is why they can be used in bioterrorism. And for pathogenesis, the polydeglutamate capsule in the Bacillus anthracis is antiphagocytic and immunogenic. And the anthrax toxin includes three protein components. First, we have a protective antigen, also known as a B component, that mediates entry of the lethal factor or the edema factor into the eukaryotic cells. Then we have the lethal factor, which happens to kill cells by cleaving the MAP kinase, and that produces a black eschar or eschar. So think of the shield with the lethal factor for the Viking burning a map, basically creating a black hole. And you can see the map over here with the black hole towards the center. And that is what the black eschar would look like in the skin. And the shield with the lethal factor initials LF. And then for the edema factor, it is an adenylate cyclase, and so obviously it's going to increase the cyclic AMP levels. So for this one, think about the shield with the edema factor, or EF, as shown over here. For the Viking in front of tents, with a camp, or in a camp. Camp as in cyclic AMP. Alright, and for diseases, one disease you need to know is called the cutaneous anthrax. It involves a papule formation, and specifically papule with vesicles. This can be described as malignant pustules. What happens is there's central necrosis, or eschar, or what this can lead to is central necrosis, or eschar, with erythematous border that is often with painful regional lymphadenopathy. So you can remember this by thinking of the Vikings burning the map over here while standing in a black ring, as depicted over here, that is surrounded by flames, and the flames symbolize the erythematous border. The black is the black eschar. And don't forget, there can be painful regional lymphadenopathy. And then there's also a disease called wool sorter's disease. This is a life-threatening pneumonia with cough, fever, malaise, and ultimately facial edema, dyspnea, diaphoresis, cyanosis, and shock with mediastinal, hemorrhagic lymphadenitis, and widening. Once again, there can also be shock with mediastinal, hemorrhagic lymphadenitis, and widening. So you can remember this by thinking of the sheep's wool over the Viking's armor, and the sheep as shown over here. And then the King Viking is holding the long-shaped axe, dripping in blood, as shown over here. Look how this axe is lung-shaped in particular, and how it is dripping in blood. And then think about the Viking ship with the mast shaped like a chest x-ray, with the rope widening the mast. So the mast over here appears to be shaped like a chest x-ray, and the rope widens the mast. That corresponds to symbolizing the mediastinal hemorrhagic lymphadenitis and widening. And don't forget these other signs and symptoms of this particular pneumonia, and all of these constitute the wool sorter's disease. And then finally we have gastrointestinal anthrax, which is a rare, and it can lead to edema and blockage of GI tract, which can then lead to vomiting and bloody diarrhea, along with high mortality. So this is pretty dangerous. And for diagnosis, you want to utilize gram stain and culture of the blood, or you can also culture respiratory secretions or lesions, and then of course utilize serology